it. It's great to see you. So this webinar, we know from our conversations with you all that youth volunteering is really high on people's agenda, both in terms of engaging with young people in their local communities and also helping to address workforce priorities in health and care. So our presenters today are going to be showcasing some fantastic initiatives that are being implemented to encourage young people into those careers. So first of all, we're going to hear from Carrie McKenzie. Carrie, most of you will probably know. Carrie's Voluntary Partnership Senior Manager at NHS England, and she's going to present an overview of the NHS Cadets programme and give us all an update on the initiatives driving youth volunteering and youth social action across the NHS. So we're then going to hand over to Rachael Hardcastle-Pearce, who many of you may know. Rachael's Group Head of Voluntary Services at NHS Humber Health Partnership. And she's going to tell us how the Humber Health Champions programme is inspiring the next generation of healthcare professionals by offering young people opportunities to get hands-on experience in clinical settings. And then our third and final presenter is going to be Emma Scott. Emma is Volunteer Services Manager at Sheffield Teaching Hospitals, and she's going to talk about the NHS Cadets programme, how it's running in their trust, and also their own internal team impact programme for 16 and 17-year-olds. So I hope that'll give you an all-round view of youth volunteering programmes around the country and give you lots of inspiration to take away with you. So we've allowed time for Q&A. You're welcome to use the chat box to pose your questions during the session, and I'll gather the questions together and put them to the presenters during the Q&A. So I think that's all. So without further ado, I'm going to hand over to Carrie now. Welcome, Carrie.
Brilliant. Thanks, Sally. And I'm going to share my screen, and it did work in our little test, but fingers crossed it will still work. So I'm sure I can see Rachel, Claire and Sally. So if you give me a thumbs up if you can see. Excellent. And it's full slides.
It is.
Brilliant. So
go for
yeah.
it.
So Sally is right. So my name's Carrie and I work within the Experience of Partnerships team with NHS England, and I lead on a number of programmes, mainly primarily focusing on embedding the voluntary community and social enterprise sector within integrated care systems, but more recently our portfolio around volunteering in workforce and youth volunteering. So I thought what I'd do is just give you a bit of an overview of the number of volunteers in the NHS. For many of you who are VSM's voluntary service managers within Trust, you'll notice over the past 12 months you have been asked to fill in monthly data returns, and this is the product of that. We have a dashboard now which enables us at a national level to understand the number of volunteers we have in the NHS. But I think more importantly, it was around demonstrating the total number of volunteers. Now, as we have, many of you on this call will have sat there with a calculator, times in the number of your volunteering hours by a national minimum wage to start showing that return on investment. And we're hoping by collecting this data nationally that we'll be able to drive forward change on behalf of all of the trust. So as well as the data, our other strategic drivers are the 5-year vision for volunteering in the NHS. So just after COVID, the government and Ruth May launched the NHS Volunteering Task Force. That was published in 2023, and it really highlights the importance of volunteering, not just for the volunteers, not just for staff experience and well-being, but most importantly for patient experience and patient outcomes. And alongside that, there is a drive within the NHS long-term workforce plan that integrated care boards should embrace volunteering as part of their overall workforce planning, and they should give due consideration to programmes such as NHS Cadets and our Volunteer to Career programme. So I'll talk a bit more about NHS Cadets, launched in 2020, and that's quite notable for a number of regions, is we launched it, and I know, Rachel, you were involved, I think, in some of the piloting, and then COVID hit. So a lot of the delivery that had been planned within hospitals all had to stop. So it shifted to online. But the mission of NHS Cadets was to attract, develop and prepare young people between the ages of 14 to be able to enter and sustain themselves within health volunteering opportunities. But most importantly, it was to be targeted against those who would not traditionally enter a volunteering. So all of us who have worked as voluntary service managers or recruit volunteers, you tend to have trends in the volunteers that you get through the doors. And what we wanted with NHS Cadets was to attract those young people who would never have considered a career in the NHS or volunteering in the NHS, as opposed to some of those whose parents actively encouraged them to volunteer in the NHS. So over the past 5 years, we've had coming up to probably 9,000 young people enrolled in the programme, and 80% of those are from what we would class as deprived or underrepresented groups. So on the right of this slide, it just gives you a bit of background of some of those cadets that we've targeted in terms of the numbers that are young carers, high numbers in receipt of free school meals, and nearly all of the cadets having a targeted characteristics. You will notice that these numbers don't add up to the 7,000, but many young people may have ticked more than one of those characteristics. So, for example, they may be in receipt of free school meals, a young carer from an ethnic minority. So this has just given you a bit of sense of the value of NHS Cadets, to those involved within NHS trusts that have recognised the value of growing and supporting and building their relationships with St John in order to recruit volunteers within their trust. I will be honest and say probably for the first 3 years of the programme, there was a slight disconnect between St John and the trust, but that's probably a lot down to the fact that volunteers weren't able to go in. But we worked with colleagues within St John, and we had a working group from NHS Trust, and we reviewed how we worked. And Emma and Rachel have both been part of that process, and we're really now seeing the benefit of trusts working closely with St John to really embed the NHS Cadets programme. And there's just some words there as well from Billy, our Advanced Pathway NHS Cadet from Bradford, talking about her experiences and what she learnt from that. We also ran a programme called Volunteer to Career. It was previously part of an organisation called Health Education England, and NHS England invested, it was coming up to nearly £1 million, to create what we classed as 28 volunteer to career pathways within clinical settings. So we provided £25,000 each to 28 NHS or health and care providers. Some of those were acute trusts, some were community services, some were hospices, some were ICBs, and others were voluntary community sector organisations, and they worked with Helpforce, who are our facilitation partner within that, to develop what they classed as a volunteer to career pathway. There are many, many trusts who are already doing volunteer to career. I know Emma with your impact programme, Rachel with your Health Champions programme, they are essentially volunteer to career pathways. So there may be many more than 28 that I'm referencing here. But from the evaluated Helpforce programme, 72% of the volunteers went on to further education, training and employment. It's worth noting here that young people weren't the target of volunteer to career. What we were looking at was targeting people who may be looking at long-term unemployed or people looking at a change in career, but we did get a number of young people through, including Amy, and I'm not sure if we've got anyone from Cheshire and Wirral Foundation Trust, but again, Amy started volunteering. She went through the volunteer to career programme, She did a lot, which probably a lot of you are doing day in, day out, so art and therapy. But because of the additional support and the support from HR and workforce colleagues, her progress then led to having enough experience to then go for a paid role within that trust. So in terms of looking forward, yes, NHS England will be changing. We will be merging at some point with the Department of Health and Social Care, but we will still be focusing on volunteering and there to support you as NHS provider trusts and integrated care systems to drive and embed volunteering within your organisations and within your health and care systems. So the 10-year health plan, that will be published, we've heard, by the end of June. There is a focus on 3 shifts, so it's hospital to community. So how do we shift care from hospitals to community? A lot of volunteers will be playing a key role within that. Analog to digital, there'll be lots of examples, I imagine, in your trusts of where you're doing digital type programs with volunteers. And then finally, from treatment to prevention, of which there is a key role for volunteers, whether that's primary care, community services, acute or mental health services as well. We will this year be issuing guidance, or a toolkit essentially, on volunteering and supporting volunteering in the NHS, and that will include a specific section on youth volunteering. My colleague Carly is on the call, and she's currently working on a toolkit and resource for NHS providers, building on all that insight and intelligence we've gathered from the Helpforce volunteer to career work, but also some of the insight and feedback we've collected from voluntary service managers and trusts to create a toolkit and resource on how to embed volunteering as that route to education, employment and training, and how it can support with workforce planning. And then finally, we've got a Volunteering for Health programme that's got another 2-3 years to run. And there are 3 specific partnerships focusing on youth volunteering, and Rachael is part of one of them. So I'm sure she'll tell you a bit about that in her presentation. But I just wanted to finish on a bit of a high, really, of understanding what youth volunteering looks like and what it will look like in the coming years. So there was a report published last week by the civil society organisation that found that actually there's been over the past 10 years, there's been an 11% increase in the number of 16 to 24-year-olds volunteering. And there's a link to that research there. Unfortunately, that is counterbalanced with a reduction in the numbers of volunteers between the ages of 55 and 64 and 65 plus. But it is really encouraging that 10% of all of our NHS volunteers are aged between 16 and 21. And there's going to be so much to build on. And I'm sure that Emma and Rachael will give you all lots and lots of ideas to take forward. And I'm going to stop there. And if anyone wants to get in touch with me or wants to know more, I'll put my email in the chat and hand them back over to you, Sally.
Great, thanks, Carrie. Amazing, thank you so much. Really great overview there. I'm not going to linger because we've got a lot to get through, so I'm going to hand over to Rachael. Welcome, Rachael. We can't hear you, Rachael, at the moment.
Yep, that's my fault. Sorry, I was on mute. Yeah, so I'm not going to do slides today. As you know, as you all know, Sally's going to play a film for me, and then at the end of the film, I'm going to talk about the power of youth volunteering and how we've been enabled, and very humblingly, to empower over 3,000 young people across Hull and East Riding over the last 11 years. We're in our 11th year now, so I'll let Sally play the film, and then I'll talk around the film at the end, if that's okay.
Okay, thanks, Rachael. Keep your fingers
Sally.
crossed, everyone. Here we go.
Young Health Champions is a volunteering programme for young people aged between 16 and 25. It's all about inspiring the next generation of healthcare professionals. We have 297 young volunteers from various schools and colleges in Hull and East Riding, and we've been helping those youngsters for the past 10 years. Lots of them have now gone on to nursing assistant roles. They've also gone off to university, and some of them have even stayed and done our nursing apprenticeship route here at the Trust.
One of the main reasons why I wanted to start as a Young Health Champion is to see first-hand experience of how different medical specialties work in the world, because I wanted to apply to medicine in the future. I think my favorite is doing tea and talking to the patients and asking them what's their favorite biscuit or their favorite drink and making it for them. I hope that I'm making someone's day better.
It's an interesting thing to do because you get to communicate and speak a lot with people and find out more about them. They're not just patients, they're people with stories, with different perspectives from different backgrounds. And it's really nice just to know that you've made someone's day. It helps me learn communication with people and it helps me gain insight into the career. A lot of people go on to become nurses, doctors, physios. It's a brilliant thing to do.
I would really like to pursue a career in medicine, and I thought I needed that first-hand experience in a clinical setting. I think seeing these doctors and nurses work has really helped me get an idea of what I want to be in the future. I really like interacting with patients, and I'll ask them just to know about their day, how they're feeling, how their experience has been. It's really nice to be able to help out just in general and be able to give back to your community.
This year, Hull University Teaching Hospitals NHS Trust decided to go into collaboration with the City Healthcare Partnership, and it was almost like, well, what's next? We need to work collaboratively more out into the community, and that's where Emma, joined forces with us with the CHCP, and now collectively we can offer youth volunteering out across the hospital and the community settings, which is going to be absolutely amazing. By us working collaboratively, CHCP and the Trust, this enables the Young Health Champions to have the passport around the NHS and healthcare so they can gain valuable experience in a hospital setting and a community healthcare setting. They could be supporting in the urgent treatment centres, in primary care, dental, pharmacy, OT, physio, so there's a whole range of ways that these people can become involved and obviously go on to fulfil their aspirations of a career in healthcare.
I was studying health and social care, and the Young Health Champions was advertising, and Rachael Hardcastle-Pearce actually inspired me to come in and doing my volunteering. Hello, Ward 31. Throughout college, I really wanted to be a midwife, but when I was volunteering, I did get picked out for this job, and to be honest, I absolutely love this job now. It is amazing. It gives you so many options and different career paths. It really opens doors.
I have met some incredible young people over the past 10 years and that don't necessarily believe in themselves. They're going to be our future workforce, and we should be embracing that and bringing them in and inspiring them. Our strapline here is believe in the young people and the magic will happen. And I think, goodness me, so much magic has happened in that period of time, and myself and the team cannot wait for the next 10 years to continue inspiring young people to come into the healthcare setting. Thank you, Sally. I think for me, what that film is it just speaks impact, doesn't it? It just speaks volumes about how all of us should, like I said, embrace those young people and give them that leg up that they need. And when I was speaking at the NAVSOM conference in Birmingham this year, I said to my audience, if we all just take 5 minutes to think about that one person in our lives that's helped us on our journeys and our career pathways into health, there'll be that one person that you can think of. My plan is to hopefully leave a legacy behind at Humber Health Partnership and continue inspiring young people. I was working with some Year 9 students yesterday at a college on the South Bank, and it was so empowering. The stats are a little bit out of date, as you can appreciate on the slides that on the film. 67% of the we're called Humber Health Champions now. We've changed the branding, we've changed the name because it was our 10th anniversary, and I just felt that things needed to change a little bit for the better of good. So 67% of our Humber Health Champions went on to apprenticeships last year in our organisation. 21% of those stayed with us. Ellie, as you saw in the film there, she became a nursing assistant, and she actually took a bit of a different route, Ellie. So she did the nursing apprenticeship. It wasn't for her. It's that good old cliche, isn't it? One size doesn't fit all. She then got a nursing assistant's role, and I keep in touch with most of them actually. And Ellie is just about to embark on her nursing career at university. So she's gone for all routes, really. But and she's decided to go into nursing. 12% of them went off to university. I'm a big believer that there is a turn in the tide around young people with regards to where they go next. It's very, very popular now for young people to go for the apprenticeship route. We've helped just over 3,000 young people now across Hull and East Riding. And my challenge this year and my objective this year that's been set by my chief nurse is that I replicate this model now over on the South Bank. So we are now one group. So I've got 3 other trusts now that I have to set up with youth volunteering. I'm well on my way to doing that. I've been out and done lots of engagement with schools and colleges. I've got 7 schools and colleges now that are about to embark on the journey that I've enjoyed over the last 11 years with the Humber Health Champions. And for me, if you trust to do it, I'm not going to say it's easy. It's not. You have to get that buy-in from your senior leads or from the people that are on the shop floor. There's charge nurses, there's junior sisters, there's matrons. And believe me, they will start talking to one another in their little huddles, their weekly huddles. They'll start talking to one another about the power of bringing in the youth into an acute setting. I never thought I'd hear myself say this, and some of you that are on here today will have known me over this 11 years journey, and you'll know that I was a real gatekeeper to my success. Those gates are now completely open, and I'm happy to help anybody, because for me it's all about leaving that legacy behind, and it's about helping those young people. I think as senior leaders sometimes we don't want to share our great work, or we don't want to share things, but I think that now is the time that we do start sharing, because these are our healthcare professionals of the future, and why wouldn't we want somebody that we've grown ourselves to look after us when we get to that ripe old age when unfortunately we might have to spend some time in our hospitals. I am about to do a lot of work with the ICB. They are going to replicate this model across North Yorkshire and Humber. The film was made by the ICB. It was commissioned by them. And, I'm very, very humble to be in this position. I've spoken to many of you that are on here today with regards to what we've created here in Hull. And I'm not adverse to continuing that work that we've done to help others. I just want to say to you that if you're thinking about it, just do it. Honestly, it's changed me professionally and personally. It's completely changed my outlook in life. And I work with lots of youth initiatives now. I even do stuff now with Humberside Police with the Violence and Prevention Partnership. I'm about to do some other stuff with St John's. And obviously I have my other hat at the National Association of Voluntary Service Managers, part of their exec team. Any questions? I'm open to any questions. I'm open to calls away from here, emails away from here. It's my driver, and it's what makes me get out of bed in the morning. So thank you for listening to me today. I appreciate all of you coming on. It's brilliant. I've worked with Carrie for a long time. We've had lots of conversations, and Carrie's helped me as well throughout the 11 years. And I'm now going to hand over to Emma Scott from Sheffield. So thank you for listening this morning.
Thank you so much, Rachel. Fantastic. Yes, I'm not going to dwell on that because it's Emma's turn now. So welcome, Emma. Really excited to hear from you.
Thank you. Can you see those slides?
We can, yeah, thank you.
Great. Okay. Well, nice to, I was going to say see everyone, but I can't. But it's nice to know that everyone's here. My name's Emma Scott. I'm the Voluntary Services Manager for Sheffield Teaching Hospitals. But I'm really here on behalf of my colleague, Jane Elliott, who's our project officer in our department, and unfortunately can't be here today, but I'm really going to be telling you about all her good work. We used to have a different youth volunteering offer at STH some years ago when we had funding from Pears Foundation, which I'm sure others probably had as well. And so we had an actual youth project officer. So, but that funding ended and I was unable to persuade either the trust or the charity who support us to keep that going. So our project officer, Jane, sort of took on the challenge because we still wanted to do something with young people, even if perhaps we couldn't do quite as much. So we've kind of got two offerings at Sheffield for young people. The first, we call it Team Impact. And this is our initiative for young people 16 to 18 to have the opportunity to come and volunteer with us. Jane works very closely with local schools and colleges to promote the scheme. It's been running for 3 years, and we've had 49 young people take part so far. So you know, we keep it manageable, we keep manageable for us, you know, with our capacity, and take on a limited number of young people every autumn. So the third cohort started in December, and the way we've been running Team Impact is we've always sort of buddied them up with an existing volunteer, and they've done roles such as welcomers. Other people might call those meet and greet. They've worked in the chemotherapy day case centre. They've done the ward activities volunteering. They've done a pharmacy running, and they've done a variety of different things. So we've been surveying them. So these are sort of the latest survey results as this group have achieved their 30 hours. We asked them, with young people, rather than asking them to stay for 6 months, which is what we normally ask volunteers, at least 6 months. With the young people, we asked them to do at least 60 hours. So they've got to 30 hours, the current cohort, just about. So we've surveyed them, and 100% feel that their confidence has improved and they feel a valued member of the team. And on the top right there, Emma and Harris in the middle there with Keith and Alison, a couple of our regular volunteers, and yeah, they're a bit of a dream team, those four. The volunteers have reported improvements in their social skills, conversation skills, teamwork, resilience, patience and empathy, and 83% of them feel the volunteering has or may have helped with decisions around their future career. And at the bottom right there are some of the team volunteers who were present at the Trust Thank You Awards, where the project won the Proud Volunteer of the Year award back in November. So our other offering for young people is NHS Cadets. So this is kind of newer to us. As I say, Team Impact we've been running for the past 3 years. NHS Cadets, we were involved with NHS Cadets prior to this year, but only in the sense of going to their meetings to do presentations, or organising for other staff members to do presentations to them and things like that. But we knew obviously the intention was always for them to be able to actually come and volunteer with us. So we recruited our first cohort of NHS Cadets in the autumn. So there's 19 volunteering with us at the moment. And we've done it a little bit differently to our other programme because we wanted to sort of keep it distinct. So Jane did liaise with a lot of other departments, maybe new departments that maybe we hadn't worked with before, like phlebotomy, neuro outpatients, and various wards. So the roles that the NHS Cadets are doing are, I would say, a little bit more hands-on than the Team Impact roles. They're getting a bit more practical experience of doing actually within a department. All our volunteers wear our volunteer uniform, but we the cadets wear their cadet lanyard, and it just helps us to know who's who and what they're doing. So this current cohort have done 708 hours collectively of volunteering since this started in November. And there's Reagan on the right. He's in phlebotomy and he's there with one of the staff. So the cadets, how are they feeling about it after their first 30 hours? 100% again feel their confidence is improved and they feel valued. They report similar improvements, but also things like responsibility, listening, customer service, and also organisation and punctuality. And all of them feel that it's helped with decisions around their future career. So that's lovely to hear. With the young volunteers, we used to have them previously working towards the National Volunteer Certificate. That doesn't exist anymore. So they now get our own certificate, very similar. And they get a certificate at 30 hours and also at 60 hours. Plus, we have a scheme where volunteers collect pin badges for the amount of hours that they've given. And we've created a special 60-hour one for the young people. Having said that, a lot of them do go on and stay with us beyond their initial period, which is great. Of course, they're included in all celebration events, etc. And just to note that obviously with the young people, we do have some slightly different policies and procedures, and we do seek parental consent for them to volunteer, and also, for media consent and things like that. Another thing to mention is our Volunteer Careers Club. So we ask all volunteers when they start with us if they want to join our careers club, and if they do, then it's very much just an information sharing thing, really. Although we do organise sort of sessions and presentations for them, but it does open them up to being able to access things like employability courses that the trust run around how to write a good application, how to do a good interview, and things like that. So they benefit in that way as well in terms of their career path, and of course, they're invited to any additional training that we do. So recently there was some training on assisting patients who are blind or visually impaired, and also some training on autism and learning disabilities and things like that. So there's lots of things if they want to, they can take the time to really get into. And there's Millie and Mirab with our Rolling Reads book trolley over at the Hallamshire Hospital, taking books around and distributing them to patients on wards. That's it from me.
Sorry, turn my mic back on. Thank you so much, Emma. It's really good to hear the view from the front line, and I hope that all three presentations have given you some inspiration and a kind of all-round view of how youth volunteering is looking around the country at the moment. So we've got some questions in the chat box. I'm going to gather them up as best I can. Firstly, Louise has asked a practical question around any issues bringing young people under 18 into your organisation. So I wonder if I could go to you, Emma, first.
Any difficulties?
Yeah, any issues actually getting younger people to take up those opportunities, so 16 and 17-year-olds?
No. I don't really know what to say. I mean, obviously Jane's worked really, really hard, and I'm not saying it's easy, but we haven't had a lack of interest, and nor have we had any resistance from the trust.
Yeah, that's good. Thank you. Louise, did you want to come in there? That was your question, wasn't it?
Yeah, sorry if I've misunderstood what you're asking.
Yeah, it was specifically how do you get over those organisational barriers, because we've tried to explore offering opportunities to as low as 16, but we encounter a few organisational barriers about getting those young people into our organisation.
What specifically are the concerns, do you know? Or...
Yeah, sometimes it's exposure to various areas, and also things like safeguarding that might come up. Yeah. We also have some of our learners with additional learning needs, and how we, support those into into volunteering and work experience sort of placements as well. So, is if you've encountered any of those issues? And
we haven't
how did you?
we haven't really. So I don't know if Rachel has. Yeah, we haven't really had much resistance. Obviously, like I say, we do have different policies and procedures and things in place for the young people, but we haven't had a lot of pushback. Rachel, I don't know.
Yeah, we'll bring Rachel in there.
Yeah, sorry. Yeah, I'm the same, Louise. I haven't had much pushback. I think that the health and safety teams are very helpful. I think if you have the appropriate risk assessments in place in those clinical areas as well, and if you speak to the clinicians, so some of our clinicians potentially have kickback. So they've said, you know, nobody under the age of 18 in ED, A&E for various reasons, midwifery or paediatrics, and a real popular one for us at the moment, and it's certainly not a popular one for me, but it's mortuary services. So the last young lady that went through our mortuary services has just cemented her dream job. So yes, there has been a little bit of resistance, but I think it's finding those right teams within your organisation to go to for a little bit of help. And all wards should have their risk assessments in place, especially the young person's risk assessment.
Thanks, Rachel. Emma, do you want to come back in there?
Yeah, just a small point as well. That, you know, obviously there's lots of things to think about, and one of them is that anybody who's managing young volunteers, you know, need to make sure that they have an enhanced DBS and all that kind of. So you need to think about who's managing them as well and supervising them.
Great, thanks, Emma. And Carrie's helpfully put a link in, some guidance around working with young volunteers in the chat box, so hope you'll find that useful. Thanks, Carrie. So we then got a question from both Jordan and Lisa around balancing volunteering roles versus paid roles. How does that work? Because we hear from many of you in our discussions that there can be some tension around that. I wonder who would like to answer that question or contribute to it. Emma? Yeah, thank you.
Yeah, I mean, I suppose we just apply the same criteria that we apply to any volunteering role, really, which is you know, that it must be sort of supplementary, it must be enhancing the patient experience. They can't rely on the volunteer to do it. It must be getting done anyway. If they didn't come in, it would still happen. You know, they can't be doing the exact same thing as someone who's being paid is doing. So of course, yes, well, they might have a go at different things. You know, they don't come in and do a 3-hour shift that's exactly the same as someone who's getting paid or anything like that. So we just apply those same criteria, and we haven't had any, again, I think we just must be really lucky. We haven't had any pushback or negativity from staff around it.
Thanks, Emma. Rachel, do you want to add to that?
Yeah, sure. I'm guessing that me and Emma seem to be in a bit of a privileged position here. So yeah, I'm kind of the same. You know, we don't have any. You know, we don't really hear much conversation about it. I think that if you've got those defined performers set out as well, and the defined roles and responsibilities of what the volunteers can and can't do, you know, that really helps. And I think that, you know, the sound is echoed right the way across the organisation. You know, they're not paid members of staff. They're not here because you might be short staffed on, you know, C6 for the day. They're here in a voluntary capacity only. So we make that very clear in our policies, our roles and responsibilities, our voluntary declaration, our expected standards, so everybody knows that.
Thanks, Rachel. So we've then got a question from Claire around evidencing the value for money. It was during your presentation, Rachel, around the figures that you were quoting. So I don't know if, Claire, you want to expand on your question. Are you asking about how to measure that impact?
Yeah, it wasn't really a question. Somebody earlier than me had asked a question about I can't remember, and it was in response to that. Because as that question was being asked, Rachel was then quoting some really good figures in terms of justifying. Oh, it was about. Sorry, I'm just looking through the chat. It was about if funding is stopping for volunteering, how do we get senior managers engaged in resources to these sorts of things? And I thought Rachel's figures were really useful, certainly from my perspective, working on health and work, that the impact volunteering can have on that kind of talent pipeline. So I don't know how true it is, you guys are closer to this than me, but I'm hearing through dispatches that young people are less interested than they were in joining health, because of all the kind of news about how awful it is and people going off sick and all that. And this seems like a brilliant opportunity to really change that narrative, particularly if you're giving all of these figures about pipeline it creates and apprenticeships and all of that sort of stuff. Sorry,
thanks, Claire. Thanks for expanding on that, Claire. I guess the key question is how do you get senior leadership to invest in those programs? So, Rachel, is that something that you'd be able to comment on?
Yeah, certainly. I mean, look, I think for us all, if you're submitting your data to the data collection, what Carrie showed us on our first slide, that is really helpful now, isn't it? Because we need to collectively hold that data anyway, so the rest of it is quite easy, really. I think that lots of senior leads work very differently, don't they? Some senior leads will work on the impact of the feedback. Some senior leads will only look at the monetary value, statistics, etc. If I'm brutally honest, statistics don't really float my boat, and how much money my volunteers have saved the organisation in a year doesn't really make me tick, because I think, well, they're not here for that monetary value anyway. However, sometimes at board level, that's what makes them kind of sit up and go, wow, okay, well, I didn't quite realise that we'd done that. That's really powerful. So I think that sometimes it's depending on who your audience is and who your arena is. But I think, again, for all of us, the national data collection, for me, has to be a game changer, because it allows us to draw down much more methodology and give much more resource back to the senior leadership, especially in the organisation. Carrie, I don't know if you kind of maybe want to come in a little bit about that, dear.
Yeah, and I think that in a way that's why we started the mandatory data collection, because with anything, it was always trying to second guess how many volunteers we had within the NHS. And now that we're capturing this data, we have that dashboard, it enables us to make that case with ministers and others at a national level. So the more that people can fit in, the more you can tell us on that mandatory data collection, please do. But also, if there's anything you think we're missing, one of the key things I personally feel we will need to capture is some of that destination data. So where do the volunteers go next? So one of the things with NHS Cadets, they may have gone and volunteered in a trust, but we might not be able to collect that data. So anything you think would be helpful for you to make the cases locally, please get in touch, because that may be something that also helps us make the case nationally.
Thanks, Carrie.
Yes, I've got a question. Sorry, Sally, for jumping back in with Morven Dunn. I'm going to put my email in the chat. Drop me an email and I'll put you in touch with my colleague who leads on the data.
That's great. Thanks, Carrie. And Emma, did you want to come in at all there around, because it sounds as if you manage really well with being resourced for your programs. How have you achieved that?
Well, only because the trust don't fund us. So our model is in my team. There's myself, although to be fair, I do manage another department as well, which is arts in health. So there's half of me, and then I have 2 volunteer coordinators, and not all of these people are full-time, by the way. 2 volunteer coordinators, an admin person and a project officer, and only 2 of those roles are funded by the trust, sort of historically, and all the rest of us, including myself, are all funded by the hospital's charity. So, you know, we're very lucky to have that, but it's by no means guaranteed forever, sort of thing. So every year I have to reapply for both our posts, but also volunteer uniform, even volunteer expenses, all paid for by the charity. So, you know, it's potentially precarious.
Thanks, Emma. Thank you. So I'm just Carrie, thank you for answering people's questions as they crop up. That's really helpful. Gives us a bit more time. So Claire's asked a question about safeguarding with under 18. So are there different implications there that you come across? That's either to Rachel or Emma. Anybody would like to comment on that one?
Yeah, so we have pastoral leads in the organisation for those young people that are under 18, and if they're from the schools and colleges, we generally ask for information, advice and guidance on those young people if they have any young underlying disabilities or they have things going on in their personal lives. With regards to an example, if a young person has sadly lost a family member, you know, from cancer, or then it would be absolutely remiss of us to put them into oncology, as it could be a trigger factor for their anxieties. And I think working with young people does pose problems sometimes anyway, because a lot of young people now suffer from social anxiety, depression, sometimes self-harm, etc., etc. But if you work closely with the schools and colleges, they're generally really good, and you can have those open and honest conversations with tutors. I know that I have a direct link to all the tutors from the health and social care courses in Hull and East Riding, and they're just brilliant. I know literally if I pick the phone up, they'll be at the other end of it. So that really helps. Under my umbrella, I am the pastoral lead in safeguarding for anybody under the age, well, the 16 to 25 year olds that I look after. But obviously, if I'm not around, then we have an amazing safeguarding team here at the Trust.
Great, thanks, Rachel. Is there anything you want to add to that, Emma?
No, not really. We just we follow Carrie's put some guidance actually about working with young volunteers in the chat, so we follow that. So I don't think you can go wrong if you follow that. We have a separate risk assessment for them. Obviously, there's the issue I mentioned earlier with the DBS for anyone that's supervising them that needs to be looked at. Other than that, we would obviously follow safeguarding procedures within our trust. It kind of links in with a question as well that Jordan asked about how much supervision do young volunteers sort of take. And, you know, I would say from my experience, it's only really worked for us when there is somebody dedicated to it. So either previously when we had that Pearce Foundation, or now when Jane's looking after them. Of course, you know, people in the departments and everything can be briefed and can be leads and things, but, you know, we all know what it's like on wards and things. It's so busy. I think the most important thing is we have, because they do have those problems and those issues, and they need that dedicated person to be able to contact. And so Jane is sort of very much at the end of the phone for them. And also we have a reviews process with our volunteers where we do a sort of, you know, semi-formal review with them after 6 weeks, and then every 6 months, and Jane will do that with the volunteers. But yeah, to be fair with the young people, she's on them she's on them all the time about something.
Thanks, Emma. Just as a follow-up to that, Amy's asked if you'd be willing to share your risk assessment template, young person's risk assessment. That'd be amazing.
Do I do that with you, Sally? And you?
Yeah, if you just send it to me, and we'll share it with the other resources from today. Thanks. And then a question from Heather, who's interested to know whether anyone has targeted care experienced young people on this kind of volunteer scheme.
I haven't targeted those young people specifically, no, so I don't know.
And is that the same for you, Rachel? Do you have experience of?
Sorry, can you just repeat that question? I didn't get it.
So,
sorry.
Interested to know whether anyone has targeted care experienced young people on this kind of volunteer scheme.
Yeah, you have, yeah.
And do you target those young people specifically? And if so, how do you?
Not specifically, no, not specifically. The whole council generally approach me about those young people, or we have a care leavers department that's set up at the Guildhall in Hull. Sometimes they'll come to me as well and ask for my advice or whether the young person would be suitable to come into the organisation.
Great, thanks, Rachel. And then Victoria's asking if anyone has any experiences outside of acute hospital settings. She's trying to start a youth volunteer group for an ambulance service. So if there's anyone on the call today who has experience of that would be amazing if you could put your details in the chat. But either Rachel or Emma, do you have any experience of working in partnership with ambulance trusts with young people? No.
Not okay. At the moment, and I am going to, but it's a little bit embargoed at the moment, so I'm not prepared to share.
Okay, fair enough. Thanks, Rachel. So can't really give you any examples at the moment, Victoria, but hopefully this will start a conversation. And as I say, if anyone has any tips, perhaps you'd be kind enough to connect in the chat box. Thank you. There's a question about volunteer opportunities in Wales for young people. I think we've got an answer to that one. We've answered Jordan's question. Okay, Joe is asking about tips for youth volunteering in mental health settings. Has that cropped up for either of you, Emma and Rachel? No. Okay, thank you. Again, if anyone on the call has experience of working with young people in mental health settings, that would be amazing. Thank you. Rachel.
Hi. The person you need to, who was supposed to be here today was Catherine Seeley. So Catherine Seeley works for Humber NHS Foundation Trust, and she does do quite a bit of work with young people over at Humber. So she's probably a good contact. Whoever asked that, Catherine Seeley is probably your best bet.
Lovely, thanks, Rachel. We'll try and get some contact details for you and let you know. Thank you. So Morgan's asking, are you able to share what you collect in the mandatory data and what the dashboard looks like? Rachel, on view, or is that Carrie? Would that be better?
Yes, so I've put my email in the chat, and I'll introduce them to my colleague Sarah Button, who leads on the data collection, who can chat them through and show them what the dashboard looks like.
Fantastic, thank you. So we've got Megan saying RVS promote volunteering opportunities in Hampshire. Who should she contact to request information about volunteer roles for young people so we can promote them on our website? So, Carrie, is that something that you'd be able to answer? Yeah. Just thinking about the volunteer portal, is there an opportunity there?
Well, I've just, if that's okay, my colleague Nicola leads on the portals on the call, so it might be worth bringing her in rather than me try and fudge something.
Is Nicola on the call today?
Yeah, she's on the call. I've just seen her in the
Nicola,
chat.
would you be able to answer that for us?
I can. Sorry, I'm just lurking in the background. This has been fascinating. Thank you. It's always wonderful to hear about youth volunteering programs. It's very close to my heart. And yeah, it's great to see them thriving. And hopefully be able to build. With regards to the NHS volunteering website, any NHS organisation or any organisation from the voluntary sector who's partnering with the NHS can advertise health-related volunteering opportunities on it. So it's very straightforward to come on board as a recruiting organisation. I will put the email address that you can reach out to in the chat, and I'll also put the link to the website so you can see what I'm talking about shortly. And I'll also finally put my email address. If you've got any queries about it at all, please do feel free to get in touch. It's completely free to use, and it's optimized so that when people are searching for NHS volunteering opportunities and they don't really know where to start, but they know they're interested in health and volunteering, then they usually find us. So hopefully that will be a big benefit to anyone who's wanting to recruit volunteers. You can put youth volunteering opportunities on there. Just the caveat is they need to be volunteering opportunities rather than patient and public voice, and so the information that people have been sharing about the roles today would apply. So hopefully that's useful. And just to answer a few people's questions about trying to find trusts that are similar to them and trying to find out if they've got youth volunteering programs, the volunteering data collection dashboard is a great shortcut to do that. So you can, the data is for the first 3 quarters is already available, but we're just doing some churn in the background, so we should be publishing the full first 12 months very imminently. It hasn't been mandatory to this point to put age data in there, so you won't see every single trust, but you can search it and go, these guys have got 25 young people, brilliant, I will go and find their email address. And that just helps you not feel like you're casting around in the dark. You can kind of pinpoint trusts similar to yourselves. It might be, you know, ambulance trusts have been discussed, or mental health trusts, but it also might be trusts in your region or trusts in your ICB, or trusts who are similar size to you. So you can use it to really gather great intelligence to help inform conversations. So hopefully you'll find that useful.
Oh, fantastic. Thanks, Nicola. I'm so glad you were here. So that's great. Thanks.
I'll start firing things into the chat.
So we got a couple of minutes. I think we've got around everybody's questions. I just want to thank everybody for sharing in the chat box and for trying to answer people's questions as we've gone along. There's fantastic engagement. Really grateful to you all for being so involved in the conversation. Thank you. So I think we'll wrap up now. Just in answer to Anna's question, we are going to share the recording and any slides, and Rachel's agreed that she will share her video as well. So hope that will inspire people. But I just want to thank our presenters for fantastic presentations, giving us such an amazing overview of what's going on across the country at the moment. It really has been inspiring, and I hope that people have felt that your questions have been answered sufficiently, but you've got plenty of contact details there to follow up with the conversation if you want to. We'll also be putting the resources on our forum on our website, so you can carry on the conversation online in that way if you'd like to. But for now, thank you all so much for joining us. Hope you've enjoyed the session, and thank you to Carrie, Rachel